occupational therapy students, and today we are going to discuss proper transfer techniques for family caregivers and care assistants to help reduce injury and increase confidence while transferring.
We're also going to discuss back injuries and the typical causes of these and ways to reduce stress on the back.
Before performing a transfer, it's important to discuss with your care recipient what you're going to do during the transfer and where you'll be moving them. It's also important to use short gestures and phrases and ask them to help as much as they can.
Before you perform the transfer, make sure that the wheelchair is properly set up. You're going to want to remove the footrests by swinging them out and taking them off. And then you're going to want to make sure that the wheelchair is angled against the mat. You're going to want to swing away or take off the armrest and make sure that the wheelchair, the wheel locks are secure.
This is a gait belt and it is worn by care recipients during transfers. So this is the gait belt's teeth and this is the smooth side. Some people think of it as an alligator's mouth, and you put the other side of the gait belt through the alligator's mouth as a tongue, and then you'll loop it back through the smooth side after you get it adjusted. Now I'm going to show you how to put on a gait belt. First, you're going to wrap it around your body like this and make sure it's not twisted. Then, like we talked about, you'll place this end through the alligator's mouth through the teeth first and pull through until it's snug around her body. You want to make sure you can only get a few fingers in between the gait belt and the body. Try and put it around her natural waist. If you have an individual with a larger abdomen or feeding tubes, you want to make sure you put it higher above those tubes. So then, after you get it through the teeth, you'll place it through the smooth edge of the gait belt and pull it through. Then, with this tail, you want to make sure it's out of the way, so you can just put it back through this part of the gait belt like this and make sure it's not out of the way.
Before performing the transfer, make sure that the care recipient's feet are set up correctly. You want them directly under the knees, and you want to angle it slightly towards the wheelchair. My legs, one of them is going to be against her outside leg, and this way my knee can guide when we're transferring, and my other leg will be pointing towards the wheelchair. This way I will not have to move my feet when we are actually performing the transfer.
Now that we have the chair set up and our feet in place, we're going to do a total assist transfer. It's important for me to be on the side so I can see where the individual is going. Her hips are also going to be closest to the chair, making the transfer even easier. If I were to transfer on this side, it means that her hips have to go an even further distance, which makes it even more challenging. So when I transfer, one option is to have your hand on the gait belt and the other hand underneath the hip for the transfer to begin. Proper posture when lifting consists of having your legs further apart for a wider base and bending as low down as possible to use your legs more than your arms when lifting. Also, moving your hips back helps add curve to your back, which helps distribute the weight when you're lifting an individual.
Notice that Catherine has two hands on the gait belt and her knees are not bent, forcing her to lift with her arms, which can lead to injury. It is important to always lift with your legs rather than your arms. Remember to bend your knees and get low. Also remember to put one hand on the gait belt and one under the individual's hips to help guide them to the chair. Never let an individual place their arms around your neck. If they begin to fall, they would pull on your neck and this could cause injury. The individual's arms should be placed at their side or around your waist. Notice during the first transfer, Catherine is twisting her back, which can lead to injury due to the extra stress. During the second transfer, Catherine shuffled her feet, which is a fall risk. Remember to shift the weight through your legs and have your feet positioned to pivot rather than shuffle.
In the following chapters, you will see more specific transfers and tips on how to perform those. Keep in mind these general tips and precautions that we just went over. I hope you're ready to lift right.